Social update UG. Uganda closes schools to fight Ebola. New cases fall. Mubende districts, the epidemic center of Ebola outbreak, pictured upon their arrival at Buhinga Stadium in Fort Portal City, where they were dropped off by government buses before heading to their respective homes in Rwenzori region as schools closed on November 25th. As you can see, those students there, those are students from Mubende district, and they were picked by government buses and dropped off into their districts. What you need to know is that the directive to close schools 2 weeks before the end of the term was announced earlier this month following the deaths of 8 children from the highly contagious disease. Uganda closed schools nationwide on Friday to curb the spread of the Ebola virus, despite the health minister insisting that new cases had declined. The directive to close schools 2 weeks before the end of term was announced earlier this month following the deaths of 8 children from the highly contagious disease. But in recent weeks, the number of new infections registered in the capital Kampala and the epicenters of Mubende and Kasanda had declined, Health Minister Jane Ruth Achenge told AFP. The major breakthrough in this fight against Ebola for Uganda is that the communities have realized that Ebola is deadly and it kills, she said. We encourage the population to remain alert and cooperative with the health terms if we are to win this battle. And there are signs Uganda is winning, she added. Uganda's World Health Organization office said Thursday that as of November 22nd, no case had been declared for 9 days in Kampala, 10 days in Mubende and 12 days in Kasanda. The outbreak has claimed 55 lives out of 141 cases, according to Uganda authorities, who have imposed lockdowns in Mubende and Kasanda. The measures include a dusk to dawn curfew, a ban on personal travel, and the closure of markets, bars, and churches. As a school in Kampala, one parent told AFP he was relieved to take his child home. I think this early closure was really necessary because of the situation, the Ebola situation in the country, said banker Joab Bariyayaka. We trust they are safer with us than staying at school, where we cannot guarantee the situation. Since the outbreak was declared in Mubende on September 20th, the disease has spread across the East African nations. President Museveni has repeatedly ruled out imposing nationwide COVID-like restrictions. According to WHO criteria, an outbreak of the disease ends when there are no new cases for 42 consecutive days, twice the incubation period of the disease. The strain now circulating is known as the Sudan Ebola virus, for which there is no vaccine, although several would be jabbed, and there are preparations of jabs for this kind of outbreak. Ebola is spread through bodily fluids, commonly with symptoms like fever, vomiting, bleeding, and diarrhea. Outbreaks are difficult to contain, especially in urban environments. Nange abana bavuddeyo ku masomero wiiki 2 earlier, 2 weeks earlier. Yeah, they came back from school 2 weeks earlier due to the Ebola outbreak, in a way to kind of control, and this has really helped because like as of late there have been no new cases in the country. Yeah, just remember to think in the comments. Don't forget to subscribe and hit that bell button. Peace.